Pancreatic cancer doesn't shout. It whispers, quietly, invisibly, until it's too late. That's why it's become one of the deadliest cancers in the world, quietly overtaking both breast and prostate cancer in many countries. Most people have no idea it's even happening. But here's the truth. In the months before diagnosis, the body often sends signals, subtle ones, strange ones, easy to miss. Yet recognizing just a few of these signs early could dramatically improve the chances of survival by as much as 70%, according to recent research. And that's exactly what this video is about. Not the obvious symptoms that show up too late, but the ones most people ignore. The ones that show up first, months in advance, when action still makes a difference. If someone in your family has ever been told, it's probably nothing, this could be the video that changes everything. Let's go. Your urine turns dark, and it's not dehydration. You might think nothing of it at first. Maybe you haven't been drinking enough water. Maybe it's something you ate. But when your urine takes on a dark yellow or brownish color, especially if you've been staying hydrated, it could be one of the first silent red flags your body is waving. This change often starts subtly, showing up as a deeper hue than usual, like cola or dark tea. And while it might seem harmless, it could point to something much more serious happening inside your body: a blocked bile duct. Pancreatic tumors, especially those near the head of the pancreas, can press against the bile duct, interfering with how bile is processed and excreted. Instead of passing through the intestines as it normally would, that bile builds up, and your body tries to get rid of it another way, through your urine. It's a symptom most people overlook or dismiss. After all, how often do we really pay attention to the color of our urine? But in the context of pancreatic cancer, this darkening can show up before more visible signs of jaundice, like yellowing skin or eyes. That makes it one of the few early indicators you can actually spot if you know what to look for. If the color doesn't go back to normal within a day or two, especially if your hydration is good, it's not something to ignore. This could be your body trying to tell you something important. And the earlier you listen, the better your chances. But urine isn't the only everyday thing that could quietly signal something's wrong. Your digestion starts acting strange. A little bloating. A sudden loss of appetite. A weird greasy look to your stool. These things might not sound like much on their own, but when your pancreas is in trouble, your digestion is one of the first systems to feel it. That's because your pancreas plays a key role in breaking down the food you eat. It produces enzymes that help your body digest fats, proteins, and carbs. When a tumor starts growing in or near the pancreas, it can block the flow of these enzymes, or stop them from being made altogether. The result? Your body simply can't process food the way it used to. What does that look like day to day? Food sits heavier in your stomach. You might feel full after just a few bites. Nausea, bloating, or even vomiting can follow meals that once felt perfectly normal. You may start avoiding food without realizing why, because it just makes you uncomfortable now. And then there's the stool. It might turn pale, float, look oily, or have a strong, unusual smell. That's because fat isn't being broken down or absorbed properly. Another sign the digestive process has been thrown off course. This isn't the kind of thing that clears up with antacids or a few tweaks to your diet. When these symptoms persist, especially when they show up together, they may be pointing to a deeper issue, one that's quietly progressing beneath the surface. And fatigue? That's the next sign, and it's more dangerous than people think. You're always tired, but this feels different. We all get tired. Long days, poor sleep, stress. It happens. But the exhaustion linked to pancreatic cancer is something else entirely. It doesn't go away after rest. It's not fixed with coffee or a weekend of sleep. It lingers, quietly dragging you down, day after day. This kind of fatigue feels like your body is running on empty, even after doing almost nothing. Simple tasks, walking to the kitchen, carrying groceries, climbing stairs, can feel oddly difficult. You wake up tired, you go to bed more tired, and nothing seems to break the cycle. Here's why. Cancer cells steal energy. They feed off the nutrients your body needs to function, draining your system in the process. As your pancreas struggles to support digestion and regulate blood sugar, your energy balance shifts, and not in your favor. But it's not just physical. This kind of fatigue often comes with a mental weight, irritability, sadness, foggy thinking, or even anxiety. The toll is both emotional and physical, and many people chalk it up to stress, aging, or burnout. But if rest doesn't help and the exhaustion grows deeper over time, it's worth asking why. Because sometimes, relentless fatigue isn't a symptom of life, it's a warning sign of something far more serious. And what comes next? A kind of pain that tells a deeper story. The pain that wraps around you. It doesn't hit like a sharp stab, it creeps in, a dull, deep ache that settles in your upper abdomen and slowly radiates to your back. You might feel it more after eating, or when you lie down at night, wondering why it won't go away. This kind of pain is common in pancreatic cancer, especially when the tumor develops in the body or tail of the pancreas. The location of the pancreas, tucked deep in the abdomen, surrounded by nerves and organs, means even a small mass can press on surrounding tissues. That pressure creates a very specific discomfort, often described as a band-like sensation that wraps from front to back. It doesn't behave like normal stomach pain. It doesn't come from spicy food or a pulled muscle. It lingers. It pulses. It sometimes improves when you lean forward and worsens when you lie flat. And most importantly, it slowly gets more persistent over time. What makes this so tricky is that it's easy to mislabel. Maybe it's gas, or a back issue, or just aging. But in reality, it may be your body trying to point directly to the problem. Doctors often look closely at the pattern of pain, where it starts, where it goes, and when it appears. And when that pattern fits what's known about pancreatic tumors, it becomes a vital clue. This isn't just pain, it's a roadmap. And for those who recognize it early, it can be the difference between catching the cancer in time or not. But there's another symptom that can mimic something as simple as the flu, and it's just as easy to ignore. You get the chills, but it's not the flu. You're freezing under a blanket one moment and sweating through your sheets the next. It feels like a bug, maybe something viral. But then it keeps coming back. No sore throat, no runny nose, no obvious cause. Just these strange waves of fever, chills, and night sweats. When this happens in the context of pancreatic cancer, it's not an infection. It's inflammation. As a tumor forms in the pancreas, it can trigger an immune response that sends your body into overdrive. The inflammation affects nearby structures like the bile duct and liver, setting off a cascade of internal stress. The result? Irregular body temperature and unexplained fever-like episodes. It's a different kind of sick. You might not even feel ill in the traditional sense, but your temperature is spiking, your body aches, and you feel run down, without any clear explanation. And because it doesn't act like a typical cold or flu, people often brush it off or wait it out. Meanwhile, the inflammation continues, and the cancer progresses unnoticed. It's also worth noting that fever, in combination with other symptoms, especially digestive changes, fatigue, or pain, can be a red flag. When the pieces start stacking up, it's your cue to look closer. And now, we move to something even more unexpected. Something you'd never guess was connected to cancer until it's too late. A clot you didn't see coming. Most people don't associate cancer with blood clots. But pancreatic cancer is one of the few that can make your blood dangerously prone to clotting, without any warning. It's called hypercoagulability, and it means your body starts forming clots in places it shouldn't, especially in the deep veins of your legs. You might notice swelling in one calf, a patch of warmth or redness, or tenderness that seems to come out of nowhere. It's easy to think you've strained a muscle or just been sitting too long. But here's the risk. If part of that clot breaks loose and travels to your lungs, it can trigger a pulmonary embolism, an emergency that can kill within minutes. Why does this happen? Pancreatic tumors release substances that throw off your body's natural clotting balance. The blood becomes thicker, more reactive, and prone to forming clumps even without injury. In some cases, the clot is the first real sign that something is wrong. Shortness of breath, sudden chest pain, a racing heart, these symptoms demand immediate care. But even before that, leg swelling, unexplained discomfort, or a change in skin color could be your early clue. If you experience anything like that, especially in combination with fatigue, digestive issues, or other warning signs, it's not just a fluke. It's your body waving a red flag. And speaking of subtle warning signs, the next one hides in plain sight at every meal. You're full after just a few bites. You sit down to eat and suddenly, you're done. Not because you're satisfied, but because you feel strangely full, tight, bloated. Like your stomach just doesn't have room anymore, even if you barely touched your plate. This early sense of fullness, known as early satiety, can be one of the most overlooked signs of pancreatic cancer. It creeps in gradually. At first, you might just eat less than usual. Then, over time, meals become smaller and more uncomfortable. You might start skipping them altogether, thinking your appetite is just changing with age or stress. But what's really happening inside the body is more mechanical. As a tumor grows in or near the pancreas, it can begin pressing on nearby organs like the stomach or small intestine. That pressure disrupts digestion, not just the chemistry of it, but the space available for food to move and settle. The result is a feeling of tightness or fullness that doesn't match what you've actually eaten. This can also lead to bloating that hangs around long after meals, making you feel heavy or distended even when you haven't overeaten. And when paired with weight loss or fatigue, it becomes more than just a quirky digestive issue. It becomes a clue. If you notice yourself eating less and feeling full faster than usual, and especially if that change is persistent, it's time to ask why. Because the next sign affects the organs sitting just upstream from the pancreas, and they're not subtle when something's wrong. A swollen organ. You didn't know you could feel. It might start as a strange pressure under your right rib cage. Not exactly pain, just a firm, bloated feeling you can't quite explain. But inside your body, something critical may be happening. Your bile is backing up, and your organs are reacting. Pancreatic tumors, especially those located near the head of the pancreas, can press against the bile duct, the channel that helps drain bile from the liver into your small intestine. When that duct is blocked, bile can't flow the way it should. Instead, it starts to collect where it doesn't belong. Your gallbladder, which normally stores a small amount of bile, begins to swell. What's normally the size of a pear can enlarge significantly, sometimes enough to be detected during a physical exam. The liver too may become congested and inflamed, adding to the sense of tightness or fullness in your upper abdomen. Modern imaging, like an ultrasound or CT scan, can pick this up long before more obvious symptoms appear. But the early warning signs? They're physical. Subtle swelling, discomfort when lying on one side, a sense that something just feels off in your torso. These aren't just random sensations. They're the body's way of showing that something downstream is creating a backup, literally. And in the case of pancreatic cancer, that chain reaction starts earlier than most people realize. But while organ swelling can be seen or felt, some of the most dangerous signs are the ones that show up on the scale. The weight drops. But you're not trying. At first it might seem like a welcome surprise. Your clothes fit looser, the scale nudges down, and you haven't even changed your routine. But when the pounds keep falling, and you're not trying to lose them, it's time to take a closer look. Unintentional weight loss is one of the most common early signs of pancreatic cancer. Yet it's also one of the most misunderstood. Many people attribute it to stress, aging, or appetite changes. But behind the scenes, your body may be struggling to absorb nutrients, or burning through them faster than it should. When the pancreas can't produce enough digestive enzymes, your body stops breaking down food properly. That means even if you're eating, you're not absorbing what you need. Fats pass through undigested, muscle mass begins to shrink, and the scale keeps dropping. Add to that the increased metabolic demand of cancer itself, where tumors consume energy like parasites, and weight loss becomes even more dramatic. If you've lost more than 5% of your body weight in a short period without trying, that's not a small thing. It's your body sounding the alarm, especially when paired with fatigue, appetite changes, or digestive issues. It deserves serious attention. And if you've made it this far thinking none of these apply to me, the next one might change that, because it's becoming more common, and almost no one connects it to cancer. Blood sugar suddenly out of control. If you've never had diabetes, and suddenly you're told your blood sugar is high, it might feel confusing. Maybe you've gained no weight. Maybe you're eating the same. But your glucose levels are climbing, and doctors can't quite explain why. This isn't just a fluke. In many cases, new-onset diabetes, especially in people over 50 with no prior history, can be one of the earliest signs of pancreatic cancer. Here's why. Your pancreas doesn't just help with digestion. It also produces insulin, the hormone that keeps your blood sugar in check. When a tumor begins to grow, it can damage the very cells that make insulin. That disruption throws your sugar regulation off balance. Suddenly, and without the usual risk factors, you might feel thirstier than usual, need to urinate more often, or just feel sluggish and foggy. Sometimes these blood sugar issues appear months before any other symptoms. But because diabetes is so common, it rarely raises suspicion. This is what makes pancreatic cancer so dangerous. It hides behind normal-looking problems. A new diabetes diagnosis might seem manageable, but when it appears alongside fatigue, weight loss, or digestive issues, it could be the thread that ties everything together. And now that you know what to look for, what you do next could make all the difference. If even one of these signs felt familiar, don't ignore it. These aren't just random symptoms. They're early clues your body might be giving you before it's too late. Pancreatic cancer thrives in silence, but awareness breaks that silence. And what you do with that awareness matters. So, here's what to do now. If this video helped you see something you hadn't noticed before, drop a comment and tell us. Someone else might read it and recognize the same sign in themselves. Hit the like button so this video reaches more people who need it, and subscribe if you want to stay ahead of health issues that most people don't talk about until it's too late. You never know who this might save. Maybe even you.